Good afternoon, everyone. My name is Dan Toner. I'm the insurance broker at FFP Employee Benefits, and I'm here today to talk about open enrollment for alumni staffing. For those of you that have been working at the company for a while, you'll notice that June 1st is our annual renewal. One thing that's changing this year is the dental and vision no longer renew every February. It's renewing in June like your medical. So all coverages, which we're going to go over in a few minutes, are renewing on June 1. That means May is open enrollment. And today is May 5th, Friday. We're going to start open enrollment next week, Monday the 8th. I'm going to go over what information you're going to receive a link. I'm going to go over that in the next few minutes. You're going to log in and make your elections for this year. So we're going to leave open enrollment open the entire week. That's the 8th to the 12th. And we'll go over what you'll see on the portal. I've attached a 20-page document. You could certainly take your time to read this. I'm going to go over some of the highlights. Who's eligible? You have to be a W-2 employee working 25 hours or more. There's a 90-day waiting period, and that's for new hires, not for existing employees. Qualifying events. If you lose coverage, you're allowed to come back on during the year if you have a qualifying event. And let's get into the health plans. So for June's open enrollment, we're going to offer 3 different health plans from Horizon, Blue Cross Blue Shield. We're going to offer that voluntary dental and vision plan from United Healthcare. And again, they all renew on June 1. Going to go over some of the highlights here. Take your time to read this for sure. Excuse me. This is just talking about the Omnia Silver and Gold and the Blue Card, but I'm going to blow this up a little bit so we can see sort of the coverages. These are the 3 plans. If you live in New Jersey, the first 2 plans would be important for you. They are what's called the Omnia Silver and the Omnia Gold. You do have access to New Jersey's network of doctors and hospitals, which is where the Omnia providers are located. You have emergency coverage if you go out of state. So there is national coverage, but it's just for emergencies. So the way that the silver and gold works, Omnia is the name of their product. And what Omnia means is they have 2 levels of coverage for every benefit. For example, if you go to a primary care physician, PCP, you will look online. We're going to go over that in a second. There is 2 levels of coverage, tier 1 versus tier 2. So if you go to a tier 1 provider, you have a $30 copay. This DW is just meaning deductible waived. When you go on the portal, you'll be able to see the full benefit summary. That's about 10 to 12 pages for each of these plans. Definitely click on that. But this is just a little cheat sheet for today's meeting. Deductible waived means you just pay a $30 copay. The deductible at the top does not apply for things like doctor visits. But if you went to a tier 2 doctor, you owe 50% AD after the tier 2 deductible. So you can see a major difference here. If I go to a doctor that accepts Blue Cross and their credentials as a tier 1 Omnia provider, I only pay $30, where I'm going to owe the first $2,500 and then 50% if it's tier 2. Now, Horizon's success is there is a truckload of tier 1 providers. So definitely we're going to go over how to look up physicians online, but you'll notice every benefit in the specialist, there's tier 1 versus tier 2. And that's how the Omnia product works. It's incentivizing you to see tier 1 providers. At the bottom, towards the bottom, you'll see some prescriptions. There's a $25 copay for generic drugs. That's the maximum you pay. If the generic drug is $2 or $4 or $8, you would pay that. You'll never pay more than $25. There is a $250 calendar year deductible, and then 50% coverage for name brands. So you're heavily incentivized to try to get generic drugs. When you go for larger claims, let's say your hospital and surgery, again, incentivizing you to go to a tier 1 hospital, you would have an $1,800 deductible. And if you look at hospitalization or surgery or imaging like an MRI, CAT scan, or PET scan, you'll see a lot of after deductibles. So here's what that means. If I have the bigger claims, hospital, surgery, MRIs, I owe an $1,800 deductible. Then it's done for the calendar year. I then don't owe a percentage of the bill. I owe a copay. An example of that would be if I go for an outpatient facility like a surgery, I have a $250 copay that I pay for that surgery after I met my deductible. If I spend the night in the hospital, I owe $500 for that night or day in the hospital. And after the 5th day, I don't pay any more. These are copays after I meet my deductible. If I have an MRI, I owe $100 after I've met my one-time calendar year deductible. Now, if I go to a tier 2 provider, I owe $2,500 plus 50% up to a $9,000 worst case scenario. That's called your maximum out of pocket. The tier 1 out of pocket is $9,100, but remember, when you pay these copays after the deductible, it's going to be very hard to meet a $9,100 out of pocket because the coverage is so rich. And that's why people like the Omnia plans. They're finding tier 1 providers, they're sticking to the tier 1 network, and they're paying less out of pocket than if they were to go to a tier 2. Very simply with Gold, you'll notice everything is lower. Your doctor copays, your hospital and surgery and MRI deductible is less, but you will pay more. And when you go to our portal, it'll show you the Blue Cross premium on how to upgrade, if you will, to pay the difference to go from silver and gold. You will have a lower out of pocket and lower deductibles if you're using tier 1 providers. Some of you may want to pay a little extra to get better coverage. There is also better medications for name brand as copays instead of 50%. So that's another reason why sometimes people will upgrade. Now, super important, as these are New Jersey only, if I lived outside of New Jersey, I can't obviously come to New Jersey for all my care. So I would have to purchase what's called the Silver with Blue card. So Blue card simply provides national access. What that means is, yes, you can come into New Jersey and see the Advantage network, but most likely you'd be in your home state and you're going to be seeing the Blue Cross doctors in your home state. Horizon is still your carrier, but they're giving you a nationwide network to use the local Blue Crosses in your home state. Okay, so that's fundamentally the difference. The company in your first year of employment is paying 50% towards your single coverage, and after 1 year of employment, they're going to contribute 50% towards dependents. That comes out, by the way, on a bi-monthly basis. How to look up your doctors, giving you little instructions here on how to go to the Blue Cross website. For those of you that are looking for the Blue card, there's some instructions here on where to go on the website to look for providers. This is a little more detail about the benefit summary for the Silver plan. This is the Gold plan, and then the Gold with Blue card. Some reminders: always register on the Horizon website if you're covered with medical. You can look up your claims, you can print your ID card, and yes, you can click, and these are the instructions on how to find a doctor. And I have some arrows. You can go in as a guest, or you can go in once you register, and this is the button for those that are looking for nationally. So take time to read this little paragraph up here. In terms of the dental and vision, we're having a PPO plan with United Healthcare. You have coverage for in and out of network, but if you're using in-network providers, your costs will be lower. Dental has a couple services, preventatives like your checkups, cleanings, and exams, surgeries, minor restorations, endo, perio work. That is 80-20 covered. They pay 80% at United, you owe 20%. And major stuff is like crowns and root canals and bridges. They cover half, you pay half. Everyone covered in your family gets $1,500. So if I'm covered as a couple, I get $1,500. My spouse gets $1,500. If I'm a family of 4, everyone gets $1,500. You can't share the family, but everyone gets $1,500. And how that works is, think about it this way: if the carrier's paying 100% of a checkup and cleaning, let's say that's $200, that means you have $1,300 left to use for the rest of the year. This $1,500 resets every calendar year, not June 1, Every January 1, you get a new fresh 1,500. This is the benefit summary in a little more detail. Vision, also done through United Healthcare. Vision, think of vision as 3 different services. A copay for your annual checkup, super important. If you have a medical condition like glaucoma, for example, that's going to be covered under your medical insurance. But if you want routine eye care, you need to purchase a separate vision plan. Routine care and reimbursements for hardware is not covered by Horizons Medical. So that's why you would purchase a plan, and we're offering it from United Healthcare. You'll pay a copay for your exam, and the rest of that exam is paid in full. If you're getting materials like lenses or contacts, lenses, for example, you have a $25 copay, and they pay the balance of that at 100%. And then if you're having things like frames, you can see that they will give you an exam once every 12 months, lenses once every 12 months, and frames every 24 months. Let's see. Okay, so that wraps up Vision. Alumni Healthcare is using my benefit link. That's sponsored by my company, FFP. Very simple, easy way. You're going to get a link on the 8th to log in, create your own password, and it'll tell you how many days are left in open enrollment. And you'll basically see on one screen all of the different health plans we're offering. Click modify to get started, and you can click next to each plan we're offering to see your bi-monthly contributions. You can waive medical and enroll in dental and waive vision. They're all separate. You can enroll as family under one and single under another. They're all separate coverages. So you'll see the United Dental and the United Vision. When you're done selecting, you'll see a congratulations notice, and that's how you know that you're completed. Last page just talks about some 800 numbers for Horizon and United, and then my team. This is me, Dan Toner. I'm the broker. Amanda is my right hand, and so is Leslie. And again, my company is called FFP, and we're happy and thrilled to service the alumni staffing folks. And feel free to let me know if you have any questions during open enrollment. Thanks. Have a great day.